So we're going to move on now to the beginning of what we've termed step 3 regarding the process of evidence-based practice. And that's going to be critically appraising the literature that we found in step 2. We have a decent foundation of the understanding of research overall. And so now we've gotten our articles from our search, and we need to see how these individual pieces of literature and the evidence that we've collected are going to help us answer our clinically relevant question. So the purpose of this lesson is going to be very much an introduction. We'll start and end step 3 in about the same place as far as describing overall what we're going to be looking for when we're evaluating a specific piece of evidence. And then in between, we will discuss specifically how you can go about doing that. So the two important things to take away from this lesson is first and foremost that we have to make sure that the overall design of the study that we're appraising is appropriate for the clinical question that they asked as well as our clinical question. So we'll be looking at those two components in particular. But also, as we've discussed previously, it's important to remember that the evidence is just a portion of the evidence-based practice model. Your clinical expertise as a clinician is also a vital source of information as well as evidence. And so despite the fact that we're just talking about this as evidence, there is more than just this specific evidence you find as a result of your search. There's all of your previous knowledge and your expertise as a clinician that also comes into play in this decision-making process. Also, obviously, the patient values and the patient as an individual is going to come into play as well as create the framework there. So our basic roadmap for how are we going to go about assessing the strength of the literature that we have found are these 3 questions. Basically, is the study valid, reliable, and relevant? And we'll spend a lot of time discussing how to figure out each of these and what these really mean in the following lessons. But right now we're just going to give the basic framework for what does this mean. So when we talk about the validity of the study, we're really talking about the ability of the study to measure and do what it says that it's supposed to do. So this can be combined into 2 things called internal and external validity, and we'll define those a little bit more later. But basically, what we're looking at is, did they control for any extra variables? Are there weird things that were done within the study or weird things that we could attribute within the process of the data collection or the study itself that might explain some of the findings beyond just the differences with the intervention? If there are things like high dropout rates or poorly devised measures, things like that, we would not be able to explain all of the differences between the group based solely on their intervention. At that same point, are they using an appropriate study design for what the purpose is within their clinically relevant question? If they're using a descriptive study design and making too many inferences about associations between their interventions and their outcomes, then we would say that the study is lacking in validity. We also have that external validity, which is basically, does these results have any impact on a greater population? If the population that they studied was too specific, it might be possible that the research is only applicable to that narrow range of individuals. Also, we have to look and see whether or not their population is similar to our population with what we're trying to decide for our clinically relevant question. And so both of these areas of validity will be explained more further, but basically we're looking at, did they do what they said they did? And does what they do have any greater impact on our clinically relevant question? The next component, and sometimes is the first component as well, it really doesn't matter either one, but the reliability of the study. Can you reproduce this study if need be? Basically, do we get the information that we need in order to apply their study to our patient population? Do we know what their intervention was? Do we know what their outcome measure was? Were those interventions and outcomes reproducible? Meaning, can we go and do the same sort of thing that they did? And if that is not the case, then obviously we would not be able to interpret the results of their findings because we're not going to be able to reproduce what they did within their program. And so we'll look a lot at reliability and the specific components associated with reliability and what that means from a research component. But when we're talking about overall reliability, it's, do we know what they did in enough of a detail and confident in what they did in enough detail that we could reproduce that and we can do it ourselves? If not, it'd be difficult for us to use anything from that piece of literature because we are not exactly sure how or what they went about doing. So overall, for our guiding questions, there are about 9 here that this group utilizes. There's a bunch of different groups and different associations that have guiding questions for basically questions for you to answer while you're reading the research. And we'll go through how to answer each of these and what each of these means. But things like, why was the study performed and what is the guiding clinical question? This is really helpful so that we can compare their clinical question or their research question to our clinical question. And if that's not the same or similar enough, then it probably doesn't matter how good the research is because it's really not applicable to our situation. Number 2, what study design was utilized, and is it appropriate to the answer of the clinical question? We discussed study design before, and this is the reason why. If it wasn't appropriate for their clinical question, then we have to question the applicability of that, of what they say within their article for our clinical question. Now, that's not to be said that we cannot use the information that is presented within there. We can make our own conclusions, but if the study design isn't appropriate for their clinically relevant question, then their conclusions are probably not appropriate as well, and so we would need to be mindful of that and make our own conclusions. Number 3 was, how was the sample size decided? We talked a little bit about power beforehand and making sure that there is an adequate amount of participants, but also that there's not so many participants that we get caught with this idea of statistical significance versus clinically applicable differences. And that's where effect size comes into play as well. Number 4, were the measurements used valid and were they reliable? We'll specifically look at how to analyze measures and measurements, but basically the study can only be as good as the instruments that are used. Think of the example we used previously about a survey. If a survey doesn't ask good questions, it cannot give us good information. The same is true with other measurements. If the measurements are not done in a way or are not of high enough quality to measure what we're trying to assess, then the information that we gather from those measurements cannot be interpreted. How were the data analyzed? We talked a little bit about statistics last time, And so were the appropriate statistics used, and what did those statistics mean are going to be the overriding portions of answering question number 5. 6, were there any problems during the study? Is there anything within the study that stands out to us that might become problematic? And these problems with the study are going to be very specific to your overall clinically relevant question. Some of them might affect the overall methods associated with the research, like high dropout rates or lack of blinding, things like that. But also, there could just be overall problems associated with how they define certain terms or how they go about measuring certain things that become problematic for our interpretation and our utilization of that information for us clinically. Was previous research performed in this area? If so, how do these results compare for question number 7? Now, this is part of the overall finding of evidence. If we only find one piece of evidence with that, we probably are looking at something either very new or we failed in step number 2 with our search. So we need to utilize both the discussion portion of that research article where the author is putting that information into context of the previous literature, but also our own understanding and see, is this an outlier? Is this similar? Is this confirming what we've read previously, or is this contradicting it? And based on that, we'll end up having to make some decisions based off of the evidence as a whole. And so understanding where each individual piece of evidence falls within the overall spectrum of the literature as a whole will help us in making that decision. Number 8 is, how does this research influence clinical practice? We can see from that question that the point very much is, my light turned off again. The point very much is to take this research and put it into practice. Now, the ability of research to influence clinical practice can be multifaceted. So some research might just have a basic science level of evidence, and so that may just help us give some theories to what we might do. Other research on the other spectrum will be very specific and high quality patient-oriented outcomes that has a very similar procedure that we would like to do with our patients and go and perform that as well. Most research falls somewhere in between, where you have to take that level of evidence and make some compromises between what they found and what you're trying to do, because their clinically relevant question is probably not exactly the same as yours. And that kind of goes into question number 9. Can the results from this study be applied to my patient case or patient population? Is there some portion of this that I can use for my population and what I'm doing? Maybe the article was focusing on a different patient population, but my patient population is similar enough that we can apply that. Other things might be, does the theory of this research article apply to my patient population, even though the specifics may not to? The idea that there can be made certain assumptions in lack of other evidence that things like joint mobilizations might have an effect on multiple joints, even though it would be best if we had the notion that joint mobilizations were effective on both shoulder and ankle range of motion. If we know that joint mobilizations have certain effects on the ankle, and we know the shoulder has similar functions with that as far as the ability to be mobilized, we could possibly use the literature from the ankle and apply it to our shoulder cases in lack of something better or more specific. So there are all sorts of different ways that we can go about trying to analyze and answer question number 8 and question number 9. But we first have to spend some time thinking about how this research is going to be used clinically, and that will lead us right into step number 4 when we get to that point. So for the next few lessons, we're going to focus on how we can go about doing this. We'll start next by just describing some basic principles and a lot of definitions, and then we'll get into things specifically in the methods sections of articles and how we can go about analyzing each component of the methods sections in particular, as well as getting into the results as well to check those for quality and applicability for our overall assessment of our case, and then thereby our assessment of the literature for use clinically. So reviewing in the end, right, it's important to remember to check to begin with whether or not the study design is appropriate for the clinically question that was asked, and then how can we use this literature along with our own clinical expertise to lead to appropriate decision making.